What would you say is the biggest public health fiasco in history? Hi, I'm Nina, and you're watching Southern Digest. If you are Dr. Martin Kulldorff, who is a Harvard epidemiologist, then you would say it is the global COVID-19 response. At least this is what he told the Epoch Times in an interview. He went on to say, and this is a quote, "Those who are pushing these vaccine mandates and vaccine passports, they're doing so much more damage to vaccine confidence than anybody else." Well, I'll agree with that. But then he says, he argues for focused protection of vulnerable peoples instead of lockdowns. Now, if that sounds good to you, then let me read you something directly from the CDC website. This is the interim operational considerations for implementing the shielding approach to prevent COVID-19 infections in humanitarian settings. I'm going to put this link down in the description box and the link with Dr. Kulldorff's interview. What is the shielding approach? It aims to reduce the number of severe COVID-19 cases by limiting contact between the high-risk groups, those most at risk for developing severe disease, and the general population, or low risk. High-risk individuals would be temporarily relocated to safe or green zones established at the household, neighborhood, camp, sector, or community level, depending on the context and setting. They would have minimal contact with family members and other low-risk residents. In theory, still reading here, shielding may serve its objective to protect high-risk populations from disease and death. However, implementation of the approach necessitates strict adherence to protocol. Inadvertent introduction of the virus into a green zone may result in rapid transmission amongst the most vulnerable populations the approach is trying to protect. You know, kind of like what happened in New York in the nursing homes. Anyway, it goes on to describe a little bit how this works. Now, it says at the neighborhood level, a designated shelter or group of shelters, a maximum of 5 to 10 households within a small camper area, would be where high-risk members are grouped together, and neighbors would swap households to accommodate high-risk individuals. Wouldn't you just love to have somebody else using your home for a while for such a noble cause? Anyway, at the camp sector level, a group of shelters such as schools, community buildings within a camp or sector, maximum 50 high-risk individuals per single green zone, where high-risk individuals are physically isolated together. One entry point is used for exchange of food and supplies, etc. A meeting area is used for residents and visitors to interact while practicing physical distancing, 2 meters. No movement into or outside of the green zone. Each green zone has a dedicated latrine and bathing facility for high-risk individuals. The shielding approach advises against any new facility to establish green zones. Oh, so maybe they won't be building any. However, few settings will have existing shelters or communal facilities with designated latrines, bathing facilities to accommodate high-risk individuals. In these settings, most latrines used by the households are located outside the home and are often shared by multiple households. You must also, as a consideration, ensure facilities can accommodate high-risk individuals with disabilities, children, and separate genders at the neighborhood camp level. Well, with 64 different genders now, I'm not sure how they're going to accomplish that. It also says that to minimize external contact, each green zone should include able-bodied high-risk individuals capable of caring for residents who have disabilities or are less mobile. Otherwise, designate low-risk individuals for these tasks, preferably who have recovered from confirmed COVID-19 and are assumed to be immune. Well, that's the first time I've heard them say that people who have confirmed COVID-19, afterwards they're assumed to be immune. But y'all, what does this sound like to you? If you're thinking it sounds like what happened over in Europe, before World War II and during, you might be right. But don't think it only happened over there. It happened here in the United States too. If you don't believe me, look up Japanese internment camps. And in my opinion, you might say that the Native American reservations are kind of similar to this too. Tell me what you think in the comments.